Falls are a serious health concern for older adults. Each year, over 30% of people over 65 fall. Most falls occur at home, performing everyday activities, walking stairs in and out of bed. Falls are the leading cause of death from injury for people over 65. More than 90% of older adult hip fractures are caused by falls. Physical injury is not the only result of a fall. The emotional effects can be devastating. The fear of falling again can cause some people to restrict their activities even if there was no physical injury. They stop doing things they once enjoyed: exercise, church, visiting with friends. Lifestyle changes can lead to feelings of loss, and helplessness may arise, affecting confidence and self-esteem. Inactivity can cause depression, decreased muscle strength and coordination, stiff joints, and constipation. Avoiding activities because of fear and anxiety can increase the risk of falling again. The goal of fall prevention is to reduce the risk of falls while encouraging independence. This training is designed to provide caregivers with the knowledge and skills to effectively prevent falls, promote safe mobility and transfers, and ensure overall household safety. Caregivers will learn to implement appropriate body mechanics and understand their responsibilities in providing care to clients, promoting both safety and comfort. Normal changes that occur with aging place the elderly at greater risk for falls. Balance is affected and reaction time is slower. Physical balance involves many body systems such as the cardiovascular system, muscles, nerves, eyes, and ears working together in a coordinated way. These systems tend to decline as we age. Older people are not the only ones prone to falls. People with chronic disease and disability that results in pain or stiff joints, weakness, dizziness, or difficulty walking are at risk for falls too. Some of these conditions are arthritis, cardiovascular disease, dementia, stroke, Parkinson's disease, osteoporosis, seizures. Medical conditions that contribute to falls should be treated by a doctor. Alcohol impairs balance, and alcohol abuse contributes to falls. Fall prevention for caregivers fall too. Take time to position your body correctly. Use proper body mechanics when helping someone to move. Don't rush to do your tasks or rush the person you're caring for. Elderly are at greater risk for falls when rushed, stressed, physically ill, or upset. Never carry objects that are too heavy or large. Don't block your vision carrying bulky packages. Make more trips instead. Wear shoes with non-skid sole and low heel and good tread. Avoid smooth leather soles or tennis shoes with smooth bottom. If laced, Velcroed, keep shoes firmly fastened. Use shoe chains or traction gear when walking on ice or snow. Use sand, cat litter, or ice melt to provide traction on ice. Use proper body mechanics to help prevent falls. Proper lighting decreases fall risk. Older adults need more light to see than younger people do. Lighting should be adjusted so that it is comfortable for them. Wear your glasses, keep active. Aging doesn't have to be falling. Balance is contributed to by many parts of the body working together. Balance is the idea that you can catch yourself when you lose your balance, not that you will not lose your balance in the first place. Look at things people don't do well. They don't use trunk muscles as well as they once did. When you can't feel the ground as well as you used to, even more important to have trunk muscles to help you. At least 1/3 of all falls in the elderly are a result of hazards in and around the home. Sliding and tripping over rugs and runners is a leading cause of falls in the home. Removing area rugs or runners is the best solution. Or use a rubber mat under rug, or use double stick tape to tape rug in place, or use rugs with rubberized backing. Place electric cords along the wall out of the walking pathways to decrease danger of tripping. Don't place cords or wires under rugs or runners. Keep walkways and middle of rooms clear, also no fans or heaters. Avoid clutter on the floor such as slippery magazines, toys, kids, pets, fans, cords. Phones should be easily accessible. Rushing to answer phone can increase possibility of falls. Have several phones located throughout house or use portable or cell. Avoid objects that blend into the carpet such as glass-topped coffee tables as they can become tripping hazards. Chairs should have back support and armrests. Armrests give support when getting in and out of chairs. We're about to dive into a critical topic: fall prevention for older adults. Falls are one of the leading causes of injury in older adults, and our goal is to equip you with the tools and knowledge to reduce that risk. By the end of this training, you'll understand how falls impact older adults, the goal of fall prevention, how to prevent falls inside and around the home, how fall prevention applies to caregivers, and, importantly, how to use a gait belt correctly to ensure safety during transfers and walking. 2. Falls and older adults. Let's start by understanding the gravity of falls in older adults. Falls are a major risk to their health, independence, and overall well-being. When an older adult falls, it can lead to serious injuries like hip fractures or head injuries that often result in long recovery times. More than just the physical injury, falls can have psychological effects as well. Many older adults develop a fear of falling, which can reduce their mobility and independence and even lead to depression. Falls are often caused by a combination of physical factors like muscle weakness, poor balance and certain medications, and environmental factors like slippery floors, poor lighting, and clutter. As caregivers, it's important to understand these risks and take steps to prevent falls. 3. The goal of fall prevention. The main goal of fall prevention is to reduce the risk of falls by addressing these factors. It's not about eliminating every risk, but managing the most common ones. We can achieve this by modifying the environment to make it safer, by removing obstacles, improving lighting, and using non-slip rugs, supporting the older adult's mobility by encouraging balance exercises and strengthening activities, monitoring medications that might contribute to dizziness or instability, using assistive devices like a gait belt during transfers and walking. The goal is to create an environment where our clients feel confident, independent, and safe while moving around. 4. How to prevent falls inside and around the home. Now let's focus on preventing falls inside the home. The home is where most falls occur, and many of these falls can be prevented by simple changes. Inside the home, clear walkways, make sure hallways, stairs, and other high-traffic areas are clear of clutter like rugs, cords, or furniture. Lighting, adequate lighting is crucial. Install night lights in hallways and bathrooms to ensure clients can see clearly at night. Non-slip mats. Use non-slip rugs or mats in bathrooms and kitchens to prevent slips. Grab bars. Install grab bars in bathrooms, especially near the toilet and in the shower or bathtub, to provide support when standing or sitting. Handrails. Stairs should always have sturdy handrails on both sides. Outside the home, clear paths. Ensure outdoor walkways are free of debris, ice, or snow. Adequate lighting. Outdoor areas should be well lit to reduce the risk of tripping at night. Small adjustments like these can make a big difference in preventing falls. 5. Fall prevention for care providers. As caregivers, we play a crucial role in fall prevention. It's not just about modifying the environment, but also about how we assist with mobility and provide support. Here are a few essential points to consider. Body mechanics. Always use proper body mechanics when helping with transfers. Bend at the knees, not the waist, and avoid twisting your back. This protects you from injury and ensures you can offer the best support to your client. Support with a gait belt. One of the most effective tools for supporting clients is the gait belt. A gait belt helps provide stability during transfers and walking by giving you something secure to hold on to without lifting or straining. It's designed to provide extra support to the client while preventing injury to you as the caregiver. We'll discuss how to properly use the gait belt shortly. 6. Gait belt use. Let's now talk about the gait belt and how to use it correctly. Here are the steps for safe and effective use. Fit the belt snugly around the person's waist, not too loose, but not too tight, just snug enough to offer support. When the client is walking or transferring, stand on their weak side and hold onto the belt with a firm grip, placing your hand near their back or side. This gives you control without pulling or dragging them. Stay close to the client, but not so close that you block their movement. Your role is to support and guide them, not to push them. Never use the gait belt to lift the person. It's meant for providing support, not lifting weight. Kitchen. Wipe or mop up spills immediately. Place a non-skid mat in front of the sink area to soak up any spills. Items in regular use should be placed conveniently between hip and eye level so they can be easily reached. A reacher can eliminate unnecessary bending or reaching. A reacher is an extension available at home medical supply stores that can be used to get to hard-to-reach items. Bedroom. The bed should be comfortable height and firm enough to get into and out of easily. Needs to be stable, not slide when getting into or out of. Move the bed against a wall to stabilize it. If wheeled, the bed should have locking wheel brakes. A telephone and lamp on the bedside table eliminate the need to get out of bed to answer the phone or turn the light on. Keep flashlight nearby for emergencies. Eyeglasses, canes, walkers should be kept near the bed. Keep electric blanket and heating pad cords out of the way. Avoid clothing that is too long or loose. It can cause a person to trip. Sit when dressing, not stand if unstable on feet. People who experience dizziness, such as from high or low blood pressure, when getting up should be encouraged to sit at the edge of the bed or chair for a few minutes before moving into a standing position. Bathrooms. Bathrooms can be slippery and present fall risks. Use textured strips and appliques in tubs and showers. Slip-resistant mats both inside and outside of the shower or tub help prevent slipping. To reduce slipping while getting in or out of the tub, avoid adding oil to the bathtub water. Grab bars are also helpful near tub, shower, and toilet. Grab bars should be placed inside and outside shower and tub area and next to toilet. A shower chair or bench with back and non-slip feet will allow someone who is unsteady to sit while showering. A handheld shower head will make it easier for them to shower while sitting. A raised toilet seat makes it easier and safer for someone who is weak or has balance problems to get on or off the toilet. Stairs. Most falls that result in serious injury happen on stairs. Stairs must be well lit so that each step is clearly seen, especially the first and last step, which is where most falls occur. Carpeted stairs should be checked regularly to make sure that the carpet is securely fastened. Check for wrinkles, loose areas, or worn spots that could cause someone to trip. Do not place area rugs or runners at the top or bottom of stairs, landings. Outside the home. Most falls that occur outside happen on curbs or steps. Improper shoes and raised steps also cause outside falls. Step edges should be marked with reflective tape designed for outdoor use. Traction tape can be applied to stair treads to minimize the chance of falls when stairs are wet. Mark uneven door thresholds with contrasting color tape. Keep pathways and stairs clean of leaves, moss, snow, or ice. Use exterior lights to light pathways. As caregivers, it's important for us to recognize that many medications can have side effects that impact our clients' balance, coordination, and alertness, making it easier for them to fall. Some medications can cause dizziness, weakness, or drowsiness, which are all conditions that contribute to falls. Let's take a look at some common medications that may increase the risk of falls. 1. Diuretics, water pills. First, let's talk about diuretics, or water pills. These medications are often prescribed to help remove excess fluid from the body, especially for clients with conditions like high blood pressure or heart failure. While they are important for managing fluid retention, they can also cause a couple of problems. Side effects. Diuretics can lead to dehydration, which lowers blood pressure and can make clients feel lightheaded or dizzy, especially when standing up too quickly. This is known as orthostatic hypotension, and it's when your blood pressure drops sharply when moving from sitting to standing. Fall risk. When blood pressure drops suddenly, it can cause dizziness or even fainting, which puts the client at risk of falling. It's important to assist clients when they stand up and make sure they're moving slowly to avoid these risks. 2. High blood pressure medications. Next, let's talk about high blood pressure medications. Many elderly clients take medications to manage high blood pressure, like beta blockers, ACE inhibitors, or calcium channel blockers. These medications work by lowering blood pressure, which is good for managing the condition, but they can sometimes have unintended side effects. Side effects. These medications can cause dizziness, fatigue, or even fainting due to a drop in blood pressure. The blood pressure can sometimes drop too much, especially when the client stands up or moves too quickly. Fall risk. If a client is feeling dizzy or lightheaded, they are more likely to lose their balance or trip, especially when getting up from a chair or bed. As caregivers, we need to make sure they take their time when moving from one position to another. 3. Sedatives, anti-anxiety, and sleeping pills. Now, let's talk about sedatives, which include medications like anti-anxiety drugs, e.g. a Valium or Xanax, and sleeping pills, e.g. Ambien. These medications are often prescribed to help clients manage anxiety, stress, or insomnia. Side effects. Sedatives work by calming the nervous system, which can cause drowsiness, confusion, or even difficulty focusing. Some of these medications can also impair coordination and balance, which is a big risk for falls. Fall risk. Because sedatives slow down the body's ability to react quickly or maintain balance, a client who has taken these medications may trip or stumble, particularly when trying to move around the house, get out of bed, or walk to the bathroom. It's important to monitor clients who take these medications closely and assist them with mobility. 4. Pain relievers. opioids and non-opioid medications. Lastly, let's discuss pain relievers, including both opioids, like morphine, oxycodone, and non-opioid pain medications, like acetaminophen or ibuprofen. Pain medications are common in elderly clients, especially those with chronic pain from conditions like arthritis or back pain. Side effects, opioids in particular, can cause drowsiness, dizziness, and confusion. They also impair reaction times and judgment, which can affect how a client moves or interacts with their environment. Fall risk, clients who are on pain medication may not realize how much their balance or coordination is being affected, making them more prone to falls, especially when standing up, walking, or navigating stairs. Why this is a major concern for elderly clients. Now that we've looked at some common medications that can increase fall risk, let's discuss why this is especially concerning for elderly clients. As people age, their bodies naturally become more vulnerable to the effects of medication. Some additional reasons fall risk increases include polypharmacy. Many elderly clients take multiple medications, and combining medications can increase the risk of side effects like dizziness or weakness. Slower reflexes and recovery. As we get older, our reflexes become slower and our bodies take longer to recover from a fall. What might be a minor fall for a younger person can be a serious injury for an older adult. A gait belt is a safety device that's used to help with walking and transferring clients from one place to another. It's typically made of durable fabric with a buckle, and it's designed to fit around a person's waist. The primary purpose of the gait belt is to give caregivers a secure way to support a client when they are standing, walking, or transferring between surfaces, like from a bed to a chair or from a chair to a wheelchair. How to properly fit and use a gait belt. Now, let's go through how to fit the gait belt and use it effectively. Fitting the gait belt. First, you want to fit the gait belt snugly around the client's waist. It should not be too loose, but also not too tight. You should be able to slide your fingers between the belt and the client's body comfortably. This ensures it's tight enough to provide support, but not so tight that it restricts breathing or causes discomfort. Make sure the belt is placed over the clothing, not directly on the skin. It should be positioned at the waist level, just above the hips. Avoid placing it too high up or too low, as this can reduce the effectiveness of the support. Assisting with walking or transfers. When the client is ready to walk, you will use the gait belt to provide support. Here's the key. Always be on the client's weak side. This is the side where they need the most help, so you can provide more support as they walk. When the client starts walking, slide your fingers into the belt, holding onto the belt securely. Make sure your grip is firm, but don't pull on the belt. The goal is to guide and support, not to drag or pull them. Your hand should be placed on the belt at the client's back or side, not directly in front of them. Staying close, but not too close. As you assist the client, it's important to stay close enough to offer support, but not so close that you're blocking their ability to walk comfortably. Allow the client to move at their own pace while keeping yourself nearby to catch them if they start to lose balance. Remember, the gait belt is not for lifting the client. Your role is to provide stability and guidance as they walk or move. If they start to stumble or fall, the belt gives you a secure way to help them regain their balance. In conclusion, fall prevention is crucial in ensuring the safety and well-being of elderly clients. By understanding the common risk factors such as medications, environmental hazards, and health conditions, we can take proactive steps to reduce the risk of falls. As caregivers, we must always stay alert to changes in mobility, provide the necessary support during transfers, and ensure the environment is free from obstacles. Small adjustments, like using a gait belt, encouraging proper footwear, and making sure pathways are clear, can make a big difference. By being vigilant, informed, and supportive, we help our clients maintain their independence and avoid injuries that could impact their quality of life. Always remember, fall prevention is about creating a safe and supportive environment where our clients can thrive.